Danielle, is there a way for me to just keep the I hope you all are doing well. Today's topic is the impact of school bullying. I do want to let you know that this is a topic where there's actually limited research, despite the fact that it's so common. So I'm going to share with you some of the information that we know as of yet and what to do about it. I think one of the challenges is that as physicians, we may actually come across it more often than we think, especially when working with children. But I hope to, illuminate some ideas and thoughts to keep in the back of your mind as you assess children for different intentions and different purposes. So welcome. Today is, I guess, September 11, 2017 in Pakistan. I wanted to let you know that the slides that I'm sharing with you were also worked upon by my colleague, Ana Paula Tovar Hernandez, but she could not be here today to present the talk with me, so I'm just doing it as a representative. So bullying involves repeated exposure of one person to physical and/or relational aggression where the victim is hurt with teasing, name-calling, mockery, threats, harassment, taunting, social exclusion, or rumors. There has been some question about whether it has to be repeated or not, but the idea is that there has to be some intentionality, and because of that intentionality, it can be a repetitive behavior. When it comes to intentionality, what we're really suggesting is that the perpetrator knows or understands that the behavior will be perceived as unpleasant and maybe distressing to the person. So it's not unintentional by mistake kind of behavior when you think that you had a joke and you made a joke and you didn't realize that somebody would be hurt about it. That would be unintentional, emotional distress. But this is intentional. And I want you to keep that in mind because in past, researchers thought that people who are bullies may not actually have a good sense of social skills. But because of this intentionality, it is now believed that bullies actually have a very deep understanding of social hierarchy and social structure and how to manipulate even a group to target the person that they're targeting. So intentionality is a very important definition of bullying. The second piece is repetitive behavior, as I mentioned before, and most importantly, there's a power imbalance. So there's a perceived imbalance that is likely to be associated, and that could be based on physical strength, a difference in numbers. So, for example, somebody who is from a minority group who's attending a school where most of the kids don't look or appear like he or she, that would be a difference in number. And then differences in self-confidence, which puts a lot of kids who are anxious, a lot of kids who are insecure or have low confidence also at higher risk of being the victims of bullying. And also popularity, status in the peer group. So there's a lot of social hierarchy that's going on. Often people who are marginalized or who are lower on the social status group are more likely to be picked on because there's less chance of anybody defending them, and there's less chance of them finding support. So that power imbalance actually plays a pretty big role in the person who gets bullied. Bullying is actually pretty common, even though we may not always talk about it, and I think in a medical community it's talked about even less. In a large-scale study that was done in the U.S., 1 in 4 students reported feeling excluded by their peers, and 1 in 10 students report being a victim of physical bullying. So physical bullying is more pushing, hurting, hitting, kicking, and so on. So this is actually more common than we think. There's some data there's a little bit of data that has come across throughout multi-countries, including Norway and Poland, and it seems like the rate of bullying is relatively similar throughout the countries. Again, just kind of using one of the studies from Canada, where they studied bullying by University of British Columbia from grades 8 to 10. 64% of kids had been bullied at school. Around 12% were bullied regularly, which means once or more a week. 13% bullied other students regularly. 72% observed bullying at school at least once in a while. And 64% considered bullying a normal part of school life. 25 to 33% said bullying is sometimes okay and or that it is okay to pick on losers. And 61 to 80% said bullies are often popular. So as you can see with these numbers, this is obviously proving the fact that bullying behavior is happening in all school systems, and it is impacting all children, regardless of age and stage of life. And in that regard, it is important for us as medical physicians to understand how does it impact other health course and emotional course of these children. So there are many different types of bullying. This is just a small example. It could be, again, name-calling, insults, shoving, hitting, and it can involve friends and peers, so that could be more related to isolation. Could be threats, intimidation, cyberbullying, which we will go more into depth. There could be spreading rumors and excluding somebody, fighting somebody, making sexual comments, making homophobic comments or racist comments, and so on. But the main types that we're going to go over is that it can basically take many forms and occurs across lifespan. It can occur in multiple settings, including school, in the neighborhood, over the internet, at home, between siblings, dating relationships, and in organized athletic activities. So one thing to keep in mind is that bullying is not stopping at the school ground. Often it actually goes on beyond that, especially when it comes to transportation. So in school buses, where there are a lot of kids with different age groups, older kids, younger kids, kids with different physiques, they're all bunched together in one bus. So it's more likely to happen in such courses because there's an obvious power imbalance. Additionally, some of the bullying can actually be presenting at home, whether that's adults bullying the children or children bullying other children. And in this day and age, when it comes to internet, it can really happen with cyberbullying. So there's a lot of questions about if we were to divide all these or analyze different types of bullying, what were the main things we can come up with? And main division or description of bullying that we can come up with is direct versus indirect. So direct is more face-to-face, more in person. It's obvious who the perpetrator is, and it's also obvious who the victim is. There's no nuanced idea about who and why. Everything is actually pretty straightforward. However, in indirect bullying, often the bully has a lot of social insight, so they understand that they can use other people, even bystanders, as a means to create an unpleasant experience. So this is where rumors come in. This is just kind of putting somebody's distasteful picture on the walls of the school, or passing it around, or texting people about these pictures. So it's hard in this case to figure out who the bully is. So it's obvious who the victim is, but it's not clear as to who the bully is and where the source of bullying is coming from. So it tends to actually be a little bit more uncertain, a little bit more nuanced. It's hard to figure out what's going to happen next, and it's hard to communicate with potentially with the bully and to point at anybody as that, hey, this is the person who's causing me problems. One should also be thinking about whether bullying behavior is related to gender difference. There was some thought that maybe, aggressive behavior occurs more commonly among boys, and since girls tend to have social relation be more important to them, that maybe they use relationship as a means to bully other girls. However, the latest data shows the fact that there's actually not that much of a gender difference, except aggressive behavior tends to lessen as kids get older. So going from elementary school or primary school to something like 7th, 8th grade, aggressive behavior tends to lessen. However, it seems like relational bullying, where somebody can be isolated or excluded or, pointed out within the group that that person is not liked or so on, that actually happens in both genders. And it's not clear whether it happens more on, in primary school in first, second grade versus in seventh, eighth grade when social connections are more important, but it seems to be persistent throughout. The other question is whether there's a question of age, whether age matters. And it is really hard thing to answer. It seems like there's some level of bullying that can happen at younger age and happen at an older age. One question is whether it's not the age that's making a difference, it's the type of bullying that's making a difference. So one thing I mentioned earlier, that aggressive behavior tends to happen earlier in children but tends to lessen over time. So maybe it's not about the age difference per se, it's the approach to bullying that changes. As I mentioned before, in past research was, when we talked about bullies, was focused on maybe bullies lack social skills, or this is the beginning of antisocial personality, or these are kids who cannot regulate their emotions, so they externalize more. However, all of these theories have been debunked now, and now it's more apparent that it's more about social status. It's more of a strategic behavior by the bully to dominate the social group at a time of environmental change. So in U.S. school system, kids actually tend to change school from after fifth or sixth grade into 7th and 8th grade. So that is an environmental change. So changing into a new school where bullies may want to actually show that they have power. And that's where it becomes a strategic behavior to dominate the social group. So it happens around transitions more than anything else. There's another theory that maybe this is an adaptive behavior. So if you dominate the social group, then you're actually protecting yourself from ever being bullied as well. And you're actually kind of creating a territory about what's okay or not okay around you, especially at a time that there's an environmental change. So if somebody's going into high school, in US that would be at 9th grade, where there's other kids who are 10th or 11th graders, by being a bully, you may actually let even the older kids know that you're strong enough to be on your own, or that you're cool enough to be part of their group, and you cannot be set aside as a marginal kid and cannot be picked on. So there's a little bit of adaptive behavior that's going on with these bullying behavior. However, what we also notice is that bullies tend to actually have inflated perceptions of self, so they think that they're actually better than other people. It kind of goes along with the idea of social status. So to them, it feels like this is their rightful space, that it's okay for them to behave the way they do because they're better and they're cooler or smarter or more talented or better looking. You can put many different attributes to it. The other piece is that they also tend to have information processing changes, where the way they process information includes attributional biases. So what that means is that if you were to review an event with them and being like, hey, do you think you did something bad here by bullying another person, to them, they would feel like they were justified. So they tend to actually read environment around them, even if it's neutral or safe, as if somebody was going to attack them. So to them, this was just more of a, again, adaptive behavior and them trying to save themselves. So they tend to attribute even normal, neutral interactions to negative interactions and then react to that. So there's actually something going on, a very biological level with these children. We don't understand that completely, but there's some studies that inform us about attributional bias. when talking about bullying, it's not fair to just talk about the bully, but also talk about what perpetuates this behavior. There is constant, it's a vicious cycle, because bullying behavior often actually gets pretty favorable social feedback. In most schools and among most children, kids who are higher on the social status, they are liked more, they're more popular. And if, for example, a bully made fun of another person who is lower in the power structure, other bystanders, by laughing, by smiling, they're actually kind of giving a positive feedback to the bully. So there's this loop of feedback that's going on within the social structure. The other piece that perpetuates bullying behavior is lack of intervention. Often the bystanders are not doing anything to protect the victim. And the teachers and other adults may not actually be aware of what's going on, or nobody will inform them in that regard, so there's no actual intervention. Again, there's also an attributional bias, but in this case, I wanted to highlight the attributional bias of the victim and not just the bully. Victims tend to blame themselves, and so because of this self-blame, it actually perpetuates the bully's behavior, because the bully, who are very socially insightful and can pick up on these cues, will be almost encouraged to continue doing it because they know the person is more insecure and more distressed. The other piece is that victims who have aggressive retaliation also tends to give a little bit of a positive feedback to the bully. So just by knowledge of being able to cause distress and have a reaction tends to be a positive feedback for the bully. So if a victim kind of tries to get mad about it and be angry and yells and screams, or tries to hit back, that in itself actually becomes a positive feedback for the bully's behavior. I'm sure you have heard the old adage that, the best way to deal with somebody who's unkind to you is by ignoring them. And by ignoring, you kind of take away the emotional excitement, and then that's actually is more likely to get the bully to lessen their bullying behavior and so on. But as you can imagine, that would be really hard for children to follow through with. So we've talked a little bit about bullies, and we've talked a little bit about what perpetuates bullying behavior. So I just want to take a few minutes rather, to talk about who gets bullied. The reality is that any child, regardless of age or gender, has the potential to be bullied. But certain populations are more vulnerable, whether that's because of mental or physical disability. So for example, kids who are depressed actually are more likely to be bullied because they are more withdrawn, they are more disconnected, they appear more marginalized, they're not part of any specific group, and that in itself will actually increase their chances of being bullied. People who have different sexual orientations, so people who have, who are homosexuals, that will put them at risk. People with different physical appearance, whether that's because of a medical condition or because of an accident or so on, or congenital, just the difference in physical appearance can result in them being higher risk for bullying behavior. And other things include race, gender, income, and religion. So this depends on the cohort of the population at school as to what the mainstream cohort is. And anybody who is not part of that cohort is actually at a higher risk. So an easier term to remember is actually misfits. So people who don't really fit into the mainstream children. So misfits, just because they're marginalized, have increased chances of being rejected by the main group, and which puts them at a marginal social status, and that leads to increased chances of being victimized by their peers. And then on top of it, because there are not too many of them, they have lower social support of somebody protecting them as well. There's some data that shows that if one has friends, even if those friends were not able to protect the victim from the bullying behavior or being bullied, but they were there to kind of talk about it later and were supportive, that victim actually has less mental health issues and less impact of the bullying behavior than somebody who doesn't have any friends and doesn't have a social support. So this kind of goes back to how social support is a big part of what goes on between the bully and the victim. Additionally, youth who appear anxious, insecure, sensitive, and lack confidence, they all are more at a risk to be bullied. And as I mentioned before, when I was talking about victims who have aggressive retaliation, this is similar to that. So victims who are provocative, who react by aggression, actually encourage aggressive behavior. So that's another piece of how certain victims are more likely to be picked on more than once. Now, going as to why we really need to know a little bit more about about bullying, it has a lot to do with it causing, having a larger impact, and not just on the victim, but also impact on the bullies and the bystanders. So victims are at increased risk for depression, anxiety, self-injury, suicidal behavior. The victims tend to have a lot more somatic complaints, and that's where we will probably be brought into picture, a lot more emergency room visits, a lot more doctors' outpatient visits. So it is really important that as part of our normal language and our normal assessment, we ask about bullying behavior. Victims are at increased risk for having increased eating disorder. So anybody who's lost weight suddenly, this is one of the things that we should be thinking about. Kids tend to have a lot higher school absenteeism, poor school performance. So if there's a distinct change suddenly, somebody who used to get good grades, and suddenly their grades began to drop, we need to be asking questions about bullying then. Kids who tend to run away or have accidental injuries, kids who abuse alcohol or drugs, and also kids who are bullied are also at a higher risk of becoming a bully. So this is a behavior that's modeled to them, and then in that way they can actually start replicating that same behavior towards their siblings or somebody else who is lower than them in the social status. So it kind of goes back to the old adage how the abused can become abuser. There's a prospective study which did a meta-analysis from research from Cambridge University that revealed that average age of bullying victimization was 12 years. And when we're talking about depression, there was a summary control for covariate effect size was reduced to odds ratio of 1.74 with a follow-up average of 7 years. So this is a long-term impact of bullying. 7 years is a long time. And this was same for men and women, and results are more likely to be conservative, estimates due to possible over-control and limited reliability. So it's probably longer than 7 years. These studies document that bullying is likely to result in serious long-term consequences and adjustment problems. And at this point, I really would like you to take a minute to reflect on some of the patients you've seen, especially if you've seen them in an outpatient basis for continuous treatment. How many times have you actually heard about their negative experiences in past in schools and how that actually plays a role in their workplace now even, or how they view themselves, whether that's about their appearance, their weight, whether they like themselves or not. It can sometimes, or more often than not, come back to their experiences in school. I also want to identify that bullies are also at a higher risk for getting into fights and committing crimes, for drugs and alcohol abuse, to drop out from school. And as an adult, bullies are at increased risk to have criminal convictions and being abusive toward their romantic partners and children. What I didn't write here is the fact that often the kids who are bullying other kids in school may actually be experiencing some level of abuse at home. These are learned behaviors. So it is possible that these kids are actually have parenting that's very domineering, where their parents are actually very controlling and demanding and hurting them, whether that's emotionally or verbally or physically. So it's also important to assess the background of what's going on for these bullies. Um, the other piece that I would add, which is not shown in any data, but this is just completely coming from my experience as a child psychiatrist, that a lot of times the the kids who are come to me who are identified as the bully in the school often are actually pretty anxious, and it's important for them to control their environment. So what I have found is that there may be some level of high functioning autism spectrum disorder where they don't understand completely what's going on socially, so they compensate for it by controlling the social environment too much and to the point that they're domineering the social group, or they're extremely anxious kids who are highly cued into the social status and social hierarchy, and then the idea of not having control or power is too scary for them, and then they start having very aggressive or bullying behavior in order to control their environment. The additional effects of bullying include a prospective study that I mentioned earlier from Cambridge University. This is more about what happens between bullying perpetration and later criminal and antisocial behavior. So this was a Swedish study that revealed the average age of bullying perpetration was 11 years. Controlling for every covariate, that the adjusted summary effect size was reduced to 1.82 odds ratio with a highly significant effect. The authors concluded generally that school bullying is a strong and specific risk factor for later offending. Thus, again, we need to be paying attention to both the bullies as well as the victims. Additionally, bystanders are also likely at a risk. They often may feel guilty regarding their lack of action. They may fear that their environment is unsafe. They may feel powerless and be drawn to participate in the bullying behavior as a means to protect themselves. Bystanders are also at increased risk for developing depression and anxiety problems, abusing drugs and alcohol, and missing school. So as physicians, some of the things that we can be mindful of is keeping these warning signs in mind. So if we hear about parents saying that, hey, this kid's objects or personal items are often missing, that may be because there's another kid who's stealing it intentionally and taking that away from them. Physical complaints, hoping to stay home more from school is a warning sign. Changes in eating and sleeping habits, significant drop in grades and performance in school, unhappiness regarding school or trouble over behavior, defensive over behavior and attitude, aggression toward younger siblings, and increased irritability or avoidant behavior are all warning signs. As you can tell, a lot of these warning signs are something that we would also see with children and adolescents who are depressed, who are anxious, or who are going through an adjustment disorder because something changed in their life. So these are very, very common warning signs. Thus, asking about bullying behavior specifically, it has to be part of our assessment on a regular basis. So you may be asked as providers as to what should one do if their kid is being bullied. And so this is just some of the advice for parents that you can give. So children and teens may not tell adults that they're being bullied because they're embarrassed or frightened. So encouraging parents to be listening more often, allow your child to discuss what's going on. Listening is an easy way to provide emotional support, especially without any judgment. Parents can suggest to seek help, ask the school administrators to find out about programs that have been used to help combat bullying. So there's a lot of such programs, including peer mediation, conflict resolution, anger management training, and increased adult supervision. And it's important that parents don't advise the children to fight back. As I mentioned before, that walking away is better than, and avoiding the bully is better than actually fighting back the bully, because that encourages the bully's behavior. Some of the advice for children is practicing what to say so they can actually kind of assert themselves when needed and be more confident. Again, low confidence, insecurity, anxious behavior puts them at risk. So helping them kind of navigate that and assuring them to kind of knowing how to say and what to say so they can present themselves as less weak or lower in the power hierarchy. So simple act of insisting that the bully leave him alone may actually have a surprising effect. Explain to the child that the bully's true goal is to get a response. It's not to do anything bad, but just to kind of get a response, and that can actually help the child feel more secure. Encourage your child to be with friends when traveling. So again, be in a pack rather than being alone, so preventing that isolated behavior. And it's important to not encourage children to work things out on their own with a young bully and avoid contacting the parents of students who have bullied your child, because that may actually cause more problems within the group. Advice for the child is to work with the school to ensure protection through adult supervision, consequences for bullies, and the school's clear message that bullying will be taken seriously. Again, most of the time, a child should not be doing all of this alone. It needs to be a partnership between the parent, the child, and the school. It may actually be helpful to explore some bullying websites with your child so that the child may know that they're not alone and that there are other ways to cope. This may actually help them feel more connected and limit the isolative experience. So as I mentioned before, those are some of the suggestions for the victims, but what about the bully, especially if there's a parent of the bully, what should they do? So it's really difficult for the most parents to learn that their child may be bullying other kids. However, parents must recognize that children who bully are at risk for more serious behavioral problems. Often they have been struggling at home or with peers themselves, and therefore it is important for them to take immediate action. And some of the suggestions are talking to your child, offering calm explanation of what your child is accused of and ask for their account of the incident, holding the child accountable for their behavior, calmly but firmly tell your child that bullying will not be tolerated, develop clear rules and expectations, provide fair but consistent consequences, spend more time with your child, carefully monitoring their activities, locations, and friends, supervise their texting and social media behavior, work with your child's school to ensure that your child is held accountable for his or her bullying behavior, ask to be informed about these behaviors, and build on your child's strengths. So encourage them to do what they're really good at. So a lot of times the bullies maybe actually have a lot more leadership skills. So it's important for them to be the ones who are maybe potentially leading the class from one room to the next, or leading the group, or responsible during the sports activities to put all the sports equipment together. They may be, helpers for the coach, or they may be helpers for the teachers. So helping them with very pro-social activities, positively engaging them in social activities can be really helpful. The other piece is to advocate at school, support your school in involving their policy regarding bullying behavior. Policies may include responding to bullying events outside of school, such as cyberbullying that affects student interaction. Adopt a position of partnering with the school, often, not accusing the school that they're not doing enough. It's not very helpful. Instead, discuss with your school staff what would benefit your child and other students impacted by a bullying event. What doesn't really help is putting bullies and victims in the same room to work out their differences in front of the school staff. It is absolutely necessary that schools clearly state that bullying won't be tolerated. However, no tolerance policies ignore the fact that some teasing and unkind behavior to others is part of typical development, and no tolerance policies may result in schools overreacting to certain events. Telling students to report events of bullying to school staff works poorly in middle and high school students. When teachers and administrators are the bullies, if administrators and teachers intimidate students or tolerate hazing rituals, it's actually impossible to have anti-bullying school climate. So most importantly, one thing that we need to do is make sure that within the culture of school, even the adults have no bullying behavior. So I just want to take a few minutes, considering this day and age where everything is on internet, to talk about what is cyberbullying. Accompanying this shift in communication, there is this piece about bullying via information and communication technologies. So the attacks are through text messaging harassment, password stealing. The bully may impersonate the victim. Blogs and websites may be used to damage each other's reputation, or posting private information, uploading pictures and videos. And it shows that the likelihood of being involved in cyberbullying is predicted by the spent online and risky online behavior. So again, as part of talking to parents, whenever there's parent management guidance or training, one may actually say that it's really important to monitor number of hours that a kid is spending online, because this directly is correlated with cyberbullying. Risky behaviors include kids who are surfing on the internet, they talk to strangers online and send sexual messages, pictures, or videos through the internet, whether that's through WhatsApp, email, or Snapchat. So this is another picture, or kind of a table just to identify bullying versus cyberbullying behavior. Again, cyberbullying is an example of indirect bullying. So I just want you to kind of keep that in mind. And just to highlight again that the number of people who are involved as bystanders in cyberbullying is much wider audience, because things can go viral in a matter of seconds. There's no safe space, because in direct bullying, you can walk away from school, you can choose not to go to school, or you can not take the bus home. But in cyberbullying, there is no safe space, and it's hard to escape, and it can happen at any time, 24 hours a day. Often bullies cannot be identified, they're anonymous, and it is harder to empathize with the target because the portrayal can be extremely negative. There's no geographical limitations. The target can easily become the bully. So I just want to take next few slides just to talk about the anti-bullying programs. I hope by now that I've been able to highlight how important this topic is and how much we should actually be involved in it. So I wanted to just mention a few programs. The Cambridge Group conducted a meta-analysis of the effectiveness of all anti-bullying programs, and they located 59 reports representing 30 programs with scientific evaluations. The author concluded that anti-bullying programs are effective in reducing bullying and victimization by 20 to 23%. Intervention schools as compared with control conditions, with the important exception of the Obvious Bullying Prevention Program, which has 5 replications. So this is the most replicated program, and it's the Norwegian, it's coming from Norwegian background. So I just wanted to take a few minutes to talk about the Obvious Bullying Prevention Program. It has 4 different components: school, classroom, individual, and community level components. And essentially what it's really trying to do is address the systemic social problem. It recognizes the fact that bullying is actually a social problem and not just an individual problem. School level components include establishing a bullying prevention committee, conducting committee and staff training, administer a questionnaire that goes throughout the school, hold staff discussion about these issues and group meetings, introduce the school rules against bullying, review and refine the school supervisory system, hold a school kickoff event to launch the program so everybody's aware and everybody's kind of starting this as a partner, and involving parents in the process. The classroom level component includes post and enforce school-wide rules against bullying. So it's more about enforcement and holding regular class meetings, hold meetings with students' parents to kind of follow up on some of the behavior. Community level components is more about involving community members on the Bullying Prevention Coordinating Committee. It's to develop partnership with community members to support your school's program. Again, bullying does not stop on school grounds. It actually goes on to the community. So it's important that there's a partnership and help to spread anti-bullying messages and principles and best practice in the community. It's to also increase awareness, and it being a cultural message for the kid from every different aspect of their interactions. And then there's individual level components, which include supervising students' activities, ensure that all staff intervene on the spot when bullying occurs, hold meetings with students involved in bullying, hold meetings with parents of involved students, and develop individual intervention plan for involved students. Again, each student can actually potentially be bullied and be bullying for different purposes and different reasons. Thus, the plan has to be a little bit more individualized. And here is my bibliography. If you have any further questions, I'm happy to take them now.